I was doing what's called a psycholytic dose of ketamine. This is a very low dose of ketamine that people can engage and have a conversation throughout the entire therapy session, right? So it's not like the eye mask, like Steve was talking about eye mask, listening to music. I do that too, but in this particular case, we were using a low dose of ketamine and doing IFS work throughout. So as we were talking, she started having this experience of feeling like she was stuck on a stone wall. And she was trying, and she couldn't move off the stone wall, and she was going up as high as she could go and as low as she could go, side to side, and she could not get off this wall. I was thinking at the time when I was working with her and doing IFS, if she had been at like an IV clinic without any therapist there, this would have been a bad trip. This would have been a really traumatizing experience for her. But we were able to talk through the whole thing. And using internal family systems, I started inviting her to become curious about what part of her was this wall. And what she realized was this wall was a protector that didn't want her to see what was past the wall, right? Her system did not want her to see past it. So as she was developing compassion for the wall, this protector that really wanted to help her and keep her safe, all of a sudden this window opens up in the side of the wall. And it was a castle. She realized it was a castle wall. And here's this big window that's opening up. So she goes and looks through the window. And the whole time I'm doing what's called the 6 F's in IFS, your compassion and connection to these parts of you. So the window opens up and she looks through the window and there's a courtyard inside. And inside the courtyard is a little girl who's just bereft. She's crying, she's freaking out, she's all alone in this courtyard. And of course, I understand this is an exile, but I'm not informing her that this is an exile. I'm working with her and inviting her to ask questions about what this exile or what this part wants her to see. So she recognizes this is her at 6 years old that has experienced all of this sexual trauma. And so as we're working, she's able to go into the courtyard and be with this little one as her adult self and updating that little one that she survived and this is where she is now. And I'm here to help you and support you. I'm the parent. I'm the caretaker that you never had. I'm the one that can keep you safe. This was incredibly transformative for her. And so she was able to be with that part and experience and witness everything that she'd gone through. And then part of the IFS healing steps is to update them and take them out of the situation and bring them to where they want to be. And so that young part said she wanted to be with her in the here and now. And so then in the experience, a drawbridge opened up in the castle wall and enabled her to walk out with this very young part and bring her into her world now. This experience, this was early on in our therapy together, but this experience opened up our ability to then go in and access all of these young parts in other therapy sessions that had all of these different experiences of trauma where we were able to go in and rescue them and take them out of these situations. And the thing that's always so profound for me is this one session that was 2 hours long, that transformation, she never had that trauma possess her again. It was done. That was then and this is now, which is really when we think about PTSD, it's that we're stuck in the past and we're looping on this past experience and we don't recognize that it's not happening right now. In fact, if you look at a functional MRI of a brain that's experiencing PTSD that happened 30 years ago and hasn't been metabolized, the brain lights up just like the trauma is happening right now. But what we see with people that have metabolized their trauma is when we do a functional MRI scan, their frontal lobes are lit up, their right amygdala is quiet, right? There's a transformation, there's a rewiring that happens in the brain. So I'm really interested in working with these medicines and really leveraging what Gould-Dolan, the researcher Gould-Dolan, talks about critical learning windows. When our brains released a ton of brain-derived neurotrophic factor, we have all this brain plasticity, we can go in and use techniques like EMDR and internal family systems and really anchor enduring change, right? And that's what I'm seeing with my clients when I'm able to combine those methods.